in Islam, and any kind of intoxication is banned in Hinduism, Buddhism, and Jainism, but none follow and succumb to the tobacco intoxication and addiction. Anna Hazare, we are talking of Anna Hazare, Swami Agnivesh, Baba Ramdev, Shri Arvind Kejriwal, Kiranji. If they all join hands to have a total ban on tobacco, we will be saving millions of rupees and lives. So they say that instead of, if someone wants to commit a suicide, rather than hanging or shooting yourself with a gun, try smoking. And I would just like to end my talk. I showed you this picture in the beginning. This lady has developed a big hole over here. She was a heavy smoker, and she didn't come till this last stage, when whatever she will eat through mouth will come back through this opening in the mouth. This is a patient who has come in this stage with bleeding through the growth, had to be immediately shifted to the ICU. And what can we do at this stage? This gentleman has come when he developed this kind of ulcers over here with maggots coming out of the wound. Chote chote keede. This is an example of a hole in the palate, a cancerous growth over here. There is an entity called reverse smoking. They will light the cigarette, and instead of the lighted butt outside, they will put it inside. So there are certain communities in India, in rural tribal communities, they have this habit of reverse smoking. They develop this kind of cancer in the palate. Some people try various desi treatments. This gentleman came after some application of desi lep, and when the skin got burnt, then he came to the hospital. Again, this gentleman is presently undergoing treatment. This has been taken on 2nd of August. He came with maggots coming out of the wound. However, having shown all this grave picture, I would still say that there is a hope. This gentleman, he is 82 years old. He came with stage 4 cancer of the neck. He underwent treatment. During the treatment, his swelling has come down, and this is after about 1.5 years of the treatment. Return of the $1 million smile. So even in nowadays, even in geriatric population, elderly population with stage 4 cancer, if we treat properly, if the doctors have got a positive attitude, we can still cure them. This lady again had stage 4 cancer coming from Darbhanga. Again, in Bihar they keep khani over here. It is a form of tobacco which they put over here, and she had been keeping this kind of khani for about 20 to 25 years, and she developed this kind of disease. However, she underwent treatment, and this is the outcome after completion of treatment. Again, stage 4 cancer of the lip, after treatment cured. This is of the cheek, underwent treatment with radiotherapy and you can see the excellent outcome. This is of the soft palate. We have got some specialized technique of treating soft palate cancers with mold brachytherapy. So this treatment was given, and after completion of treatment, this patient was again cured. Again, he is an 85-year-old male who presented with an ulcer over the scalp, which was they came to the hospital only because they started bleeding, emanating foul-smelling discharge and worms coming out from here. He was trolley bound. His treatment was done, and this is the outcome after 3 months of treatment. Again, very elderly male with a massive node over here in the neck, underwent treatment, had lot of reactions during the treatment. However, at the end of the treatment, he has been cured. Cancer of the lip, before treatment and after treatment. So, I would lay my stress mainly on control over the tobacco in any form. And again repeat that bad habits can ruin even a good horoscope. Thank you. I invite a few questions from the floor, and I have got more prizes to distribute. Maybe one of the best questions I can distribute, one of the prizes. Again, I can ask you some. Yes. Yes, very good question. See, whenever we treat cancer, we never say 100% cure rate. For that matter, even God has not given us 100% guarantee. Every one of us will have some disease in our lifetimes. All of us will pass away from some disease. So even God has not made us perfect. Similarly, the treatment for cancer is not 100%. Sometimes the cancer may come back after 2 years, after 20 years, after 15 years. And that is the reason once a patient completes his or her treatment, first 2 years are very crucial. There is a very high likelihood of disease coming back in first 2 years. If first 2 years are left, then the chances of disease coming back go down. And that's why once we complete the treatment for first 2 years, we ask the patients to come for clinical checkup every 3 to 4 months. After 2 years, between 2 years and 5 years, we call them after 6 months. And after 5 years, it is up to the wish of the patient. We tell them you may not come, but then they are very apprehensive, worried. चलो एक बार चल के दिखा देते हैं, साल में एक बार आके, they get themselves checked and go back. So there is a likelihood of disease coming back. That's why we keep on close follow-up. Are you from faculty? No? Okay. Okay, please. See, the treatment of cancer, basically it can be by surgery, by chemotherapy, by radiotherapy, by a combination of any two of the modalities. A patient may undergo surgery and radiation, a patient may undergo radiation and chemotherapy, or chemotherapy alone, various combinations as per the site of the disease and stage of the disease. So, radiation is a localized treatment. It will have its effects only on the part where radiation is delivered. So if it has been delivered in the region of breast, that part of the skin will become dark for 3 to 4 months. It will regain its normal color after 3 to 4 months. If a patient has undergone radiation for this part of the body, head, there will be a loss of hair for a couple of months. After that it will come back. As you saw in this case which I showed you, there was a complete loss of hair in that region. But those hair may come back after 6 months, 9 months. However, the hairs which come back, the texture is very different, they are very soft. And memory loss, no. There won't be any memory loss unless and until we are treating for brain tumors. Yeah, so we have got very precise techniques of delivering radiation in which we protect the eyes. So unless and until the tumor is sitting right behind the eye or inside the eye, there won't be any vision loss. Yes, yes, please. Yes, yes, yes. Say for example, this is very common in breast cancer, ovarian cancers. There are some genes. Basically, one of the commonest causes which we are yet to complete the research on is changes in the genetic structure. Genes get defective. When we get exposed to any kind of radiation, there is radiation even in the backyard, cosmic rays, or when you get some tests done, x-rays done, even a single particle of x-ray can make a change in your genes. It can damage the DNA. And that DNA, if say for example one of the DNA has got damaged, I may not develop cancer in my lifetime. It may not have any impact on my life. but when I will have my children, in those there is a slight chance that that defective DNA may lead to production of defective cells, which can develop into cancer. Or after 2 or 3 generations, that gene may manifest itself. So there is a very high incidence in cases of breast cancer. That's why we call all ladies, all girls with a female member in their family, if they have had a breast cancer,